Hi friends, I am Dr. Suryakant, Professor and Head at Department of Respiratory Medicine at King George's Medical University, Lucknow. Same time, I am also the member of National Task Force for National TB Elimination Program and also the chairman of North Zone Task Force, which covers the 10 important states of northern part of the India, Jammu Kashmir, Himachal, Punjab, Chandigarh, Haryana, Rajasthan, Delhi, Uttar Pradesh, Uttaranchal. Actually, tuberculosis, as you know, it's an infectious disease caused by Mycobacterium tuberculosis, a bacteria. And this disease is spread via droplet nuclei. When a person having active tuberculosis coughs, it releases 3,500 TB bacteria. And when somebody inhales these bacteria, this leads to the TB infection. Now, every infection does not culminate into active disease. So, whenever there is an exposure to tubercular patient, there is a chances of infection only 30%. And later on, once you are infected, then later on the chances are that 90% time you will remain a case of latent TB and only 10% lifetime risk to develop active tuberculosis. So what is latent TB? Latent TB is that you have been exposed to TB bacteria and you have developed infection but not active disease. So there is no symptom, no cough. So what are the symptoms? What are the symptoms of active disease? The chronic cough for more than 2 weeks, associated with hemoptysis, that is blood in sputum, fever which is of low grade but it is increasing in the evening, associated with night sweats, decreased appetite and weight loss. If somebody is not having these symptoms but has been exposed to TB case and has developed infection, so this is the latent TB. So latent TB means presence of TB in bacteria inside the body but there is no symptom, there is no active disease. So this is latent TB. No, not at all. TB infected person, the latent TB fellow cannot spread TB to anyone. So be friendly with latent TB. Yes, the question comes then who can spread? Yes, the active tuberculosis, that is to pulmonary tuberculosis means TB of lung. Now TB can be of two types. TB of lung, that is called pulmonary tuberculosis. TB of other organs of the body, they are called extrapulmonary tuberculosis. TB of brain, TB of abdomen, TB of kidney, TB of skin, TB of bone and joint, etc. etc. You see, any organ of the body can have TB except hair and nail. That's all. So any person who is having active TB of lung is an infectious case. If you examine his sputum, it will be positive for acid-fast bacilli, that is TB bacteria. It will be positive for CBNet or TrueNet, that is molecular test for the TB diagnosis. So any person who is having latent TB is non-infectious. Any person who is having TB other than lung means extrapulmonary tuberculosis, again non-infectious. And any person who is having active TB but has taken at least 1 month of treatment for tuberculosis, again he becomes non-infectious. So only a small subset of patients of TB who are having TB of lungs and their sputum is positive for TB bacteria, that is called, test is called sputum for acid-fast bacilli, or a molecular test is positive in the sputum, that is called sputum for CBNet or TrueNet. They are the real cases which are infectious and you have to take care to exposure of such type of patient. Otherwise, as I mentioned, latent TB is non-infectious, it cannot spread TB to other fellows, and extrapulmonary tuberculosis, they cannot spread TB to other fellows. Sputum negative pulmonary tuberculosis, they cannot spread the TB to other fellows, and an active TB person who was positive in the sputum but has taken at least 1 month of adequate treatment for tuberculosis, he or she also become non-infectious, cannot spread the TB to others. Any fellow who is having important tuberculosis symptoms like cough for more than 2 weeks, blood in sputum, fever which is more in the evening associated with night sweats, loss of appetite and weight loss should be tested for TB test. Then what are the tests? Yes, two tests are the basic minimum tests for the diagnosis of TB. What are they? Sputum for acid-fast bacilli, 2 samples. Sputum for CB-net or TrueNet, 2 samples. So these 2 samples should be carried out for both tests, and if at all they are positive, then patient is notified. So TB is a notifiable disease, and there is a portal, online portal called Nikshay portal, and the disease is notified, and once it is notified, the treatment can be started. And my dear friend, another plus point is that any TB patient who is notified after the diagnosis will also get 500 rupees per month as a nutritional support. And these tests, these drugs, they are available free of cost in any government hospital under the program that is called TB Bharat Mukt, Pradhan Mantri TB Mukt Bharat Yojana. So the diagnosis of TB is free in this country in any government hospital. Treatment is free, and 500 rupees per month as a nutritional support, that is also being given as a DBT, direct benefit transfer, in the account of the patient. The question is that we can diagnose with the sputum test and some other tests like chest X-ray, CT scan, MRI. For extrapulmonary tuberculosis, you can have so many more tests. But who should be tested for latent TB, and what are the tests? So any person who has been in contact with a person who has now been diagnosed as active TB, now his family contact, his official contact, his personal contact, they all should undergo the testing for latent TB. Then what are the tests? Yes, important and very simple test is TST, that is tuberculin skin test. Another test is IGRA test, if at all it is available. That's costly also, but in program we are doing the TST, that is tuberculin skin test. Another name for TST is the tuberculin test or the Mantoux test or the PPD. So this test is a very simple test. You take the PPD, of course 0.1 ml in a tuberculin syringe, and you inject in the flexor aspect of the left arm, and you just take the reading of induration at that site after 72 hours. And if it is 10 millimeter, the diameter of induration at that local area, the injected area is 10 diameter is 10 millimeter or more than that, it is called positive, and it shows the latent TB. So any person who has been in contact with the active TB patient should be investigated for this test, and similarly also chest X-ray, PAV also be done. Why? To rule out the active disease. Then only we should declare that this patient is having latent TB. And if latent TB is there, then of course there is a risk for developing, as I mentioned earlier, there is a risk for developing active TB in future. So patient can be given the TB preventive therapy, TPT, as per the advice of a doctor or in any government hospital. And it should be given only when the active disease has been ruled out. And we should remember that such type of patients should be educated that whenever there is a symptoms of active TB like cough, blood in sputum, fever, weight loss, loss of appetite, they should again consult to the treating physician or doctor, or they should go nearby any government hospital and they should be investigated again, because there is a 10% lifetime risk for latent TB to develop active TB. You see, TB is a very socially discriminated disease, I would say, so social taboo is there. I wrote an article in 2017 that this social discrimination for TB patient, and it is still prevailing. I have noticed that children suffering from TB, they are being discriminated by their not only class fellows in the schools, but also in the family children. The children, they are not sitting with them, they are not playing with them, they are not sharing the tiffin, they are not eating with them, dancing with them, they are ignoring them, they are avoiding them. That should not happen. Especially females, I have seen that even divorces are being given, the separation are being done, they are being sent to their father's house. They are being socially discriminated. This should not happen. TB is a disease which is 100% curable disease. Only few diseases are curable and TB is one of them. The government is supporting by providing free investigation, free treatment and nutritional support of 500 rupees per month. Why you should not? The government is doing too much. Why our responsibility also that we should do something. At least we should not have social discrimination with them. And that's why our governor, UP governor, Srimati Anandiben Patel, she started the program of TB adoption program. That is, you adopt the TB program and you should meet once a month and you should provide the nutritional support, emotional support and social support to such patients. And now it has become a national policy. This is called to make Nikshay Mitra. So, be the friend of TB patients and support them nutritionally, socially and emotionally. So come together, join hands together with the National TB Elimination Program and become the Nikshay Mitra. So this is the high time when we should not discriminate. The question is, you can ask that Dr. Suryakant, somebody says that we have to avoid the exposure to the patient. Yes, any patient who is sputum positive for TB has been notified as a case of TB and as a active pulmonary tuberculosis. Yes, he can spread TB but provided that he has taken 1 month adequate treatment, he becomes non-infectious. Other cases like lymph node tuberculosis, brain tuberculosis, bone and joint tuberculosis, they are not infectious. Children who are having lymph node here, they are not infectious. Tubercular meningitis, brain TB, they are not infectious. And sputum negative TB, they are not excreting the bacilli in the sputum, they are not infectious. So you have to, and one more thing, that if any person who is in family or in close relation or at your workplace colleague, if he or she is having such symptom and if you carry this patient to the health center, any government health center, and if this patient comes out to be TB positive and notified, you will also get 500 rupees as a TB informant. So utilize this opportunity. Not only that you are getting 500 rupees, but also you can become Nikshay Mitra and we can join hands together of Prime Minister ambitious dream to end TB by 2025 by becoming Nikshay Mitra, by becoming TB informant and of course joining hands against the fight against TB to eliminate TB in this country as soon as possible, or as Prime Minister says, end TB by 2025. So TB is a curable disease and only thing is that TB patients should complete the treatment as per the advice of doctor. If there is any problem to any anti-tubercular drugs, you can discuss with the doctor and everybody should be involved from I say Pradhan to Pradhan Mantri, everybody should be involved for eliminating TB in this country. So any patient in vicinity of yours who is having cough for more than 2 weeks should be investigated for TB and should be of course treated properly. So be a part of TB elimination program. Thank you very much.